Hey everyone and welcome back. Today we'll be talking about fever management, and fever management is a very important topic for everyone, especially for kids, because it constitutes about 20% of emergencies, and the parents have to know when to present to the doctor in order to check for the causes of the fever. Now, first of all, we have to know what is fever. So, normally the body temperature is of about 37 degrees Celsius or 98.6 degrees Fahrenheit. Fever means that we have a rise in this temperature of about 1.5 or 1 degree Celsius. So we get 38 or 38.5 degrees Celsius. And in Fahrenheit it will be 100.4 to 101.3 degrees Fahrenheit. This means that we have a fever. 38 or 104, that lower limit, would indicate that we have a fever in neonates, so newborns of about 1 month of age, so from the moment of birth up till 1 month of age, neonates, and immunocompromised patients. Immunocompromised patients. For example, patients with cancer, HIV, so on and so forth. So, in this category of patients, when we have just 1 degree more than usual, that would indicate that we have a fever and has to be checked out. In all the other patients, we have half a degree more for the indication of having a fever. So this is what fever means. Now, what's the difference between true and false fever? What does it mean? True fever indicates that we have this rise in temperature. It's there because of a reaction of the body. We have these cells, we have monocytes and macrophages in the human body, in the immune system, and those cells would react to any change that would happen, any toxic change, viral infection, bacterial infection, so on and so forth. And those cells reacting to these events would produce things that we call inflammatory markers. So we have those markers that, if found in blood, they will indicate that we have an inflammation. For example, we have cytokines. We have creatine kinase, or CK for short. We have tissue necrosis factor alpha, TNF alpha. We have interleukin 1, interleukin 6. All of those markers, if we found them in blood, it means that we have an inflammation, and this would indicate that that would correspond to the fever, so that we know that the fever has actually a reason, and then further investigations should be done. So, and that, all of those markers would signal to the anterior hypothalamus. In the brain, and the anterior hypothalamus is the part of the brain that regulates the body temperature, and accordingly it will raise the temperature of the human body, and we get the fever. Alright then, so this is true fever. What about false fever? False fever is we get the signs and symptoms of a fever, but not really with this rise in temperature. We don't get the rise in the temperature. So false fever would present with fatigue, headaches, maybe a rash, skin rash, discomfort, so on and so forth. But we don't have the rise in the temperature. For example, this can happen according to a CNS disease, a central nervous system disease, that would affect the hypothalamus. For example, that can occur due to excessive heat, load, exposure. An example of that would be a kid who was left in a closed car. So exposed to the heat, this might lead to a false fever. We can have also burns, heat strokes, so defects in the heat dissemination from the human body. That could also lead to the symptoms of a false fever. Okay, so now we know the difference between true and false fever. What is the purpose of or the orientation of controlling this kind of fever? Antipyresis. Antipyresis. So, pyresis is heat, antipyresis is combating that heat. We need to decrease that general rise in temperature back to normal limits. So we have options for that. We have acetaminophen. So acetaminophen. We have ibuprofen. Those can be administered with maximum 4 doses. For acetaminophen would be 15 milligrams per body weight per dose, and ibuprofen will be 10 milligrams per body weight per dose. And ibuprofen should not be used in children of less than 3 months of age, so we don't use it in that case. Also, a very important hint for the circadian rhythm of raising the temperatures. The temperatures would reach their maximum according to the anterior hypothalamus activity. It would reach a peak at 7 p.m. and the lowest at 7 a.m. That's the time, so that's usually the time when most of the cases with children with fever would present to the emergency department. At the evening at 7 p.m. you'll get most of the cases. Now, So that was generally the difference between true and false fever. Also, the antipyresis treatment here only aims to decrease the heat, to decrease the temperature, and it's not aiming to decrease the risk of getting the fever once again, or to decrease the febrile signs and symptoms of the fever, only to decrease the rise in the temperature, and we have to bear that in mind. Now, after we knew all of this, we have to talk about measuring the temperature. So, we have different ways of measuring the temperatures. So, the most accurate temperature management would be through the rectal route. So, rectal route would have the right temperature. The oral or tympanic, so through the ear, would have a 0.5 to 0.6 degrees Celsius less than the actual accurate temperature of the human body. The axillary measurement is the least accurate of about 0.8 to 1 degrees Celsius less than the actual measurement of temperature. So, especially for kids, when they present to the emergency department for the temperature to be taken, the temperature should be taken through the rectum. So that was fever management in general. Next time we talk about fever, to be more accurate, we will discuss about the bacterial infection. So how to differentiate between different bacterial infections in kids and how to manage each of those individually. So until the next video about fever, I thank you for watching and see you.